Thank you, sir. Good evening to all IFPH members and doctors and my dear colleague. This is 2001 day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy, on 3rd July 2026, Friday at 8:30 p.m. And before proceeding, let's have 1 minute silent prayer. IFH aims to reach every home and fulfill these objectives. We have been conducting the Zoom webinar since September 2022 for 3 hours in three different languages: Hindi 7:30 p.m., English 8:30 p.m., and Malayalam 9:30 p.m. Now, our today's guest is Dr. ASMITA Rathod, BHMS, RMO, Sainath Homeopathic Hospital, Rajkot, Gujarat. And her today's topic is Try Miasmatic Materia Medica. A very warm welcome to you, ma'am. Now you can start your presentation.
Myself, Dr. ASMITA Rathod. I am from Rajkot, Gujarat, India. My topic is today Triasmatic Materia Medica about Baraita group. Let me share my PPT. In classical materia medica, understanding the genetic constitution of human being is absolutely essential to formulate an accurate drop. Deep acting prescription means हमें genetic understanding भी उतनी अब necessary है. Like हमारा mental like mental makeup, physical makeup, general makeup. An individual constitutions relies heavily upon their underlying fundamental defense, which our miasms translate directly to the active or dominant miasm. We analyzing the mental makeup, like our social orientation, like introvert or extrovert. In mental makeup, will intellect. Intellect means learning, speed, processing capacity, logic. Likewise, morals. In morals, like ethical standards, persons having morals or immorals, like use ethicals. Sensitivity about the susceptibility to external emotional physical factors, like sensitivity to all in general, like sensitivity to change of weather, sensitivity to emotions imbalance, etc. Emotional reactions, like emotional reactions like anger, fear, anxiety attack, panic attack. Likewise, speed or intensity of expressive uh, say reactions. Conscience, inner sense of right or wrong, or subsequent guilt. Physical makeup generally mental makeup, like a physical makeup, like hair quality, like texture. We should we prone to Brighta group. So Brighta's hair, like messy hair, or face type, like a squarish type of face. Brighta's face is squarish type or rounded face, body face. So face type is also must to observe. In height and build, we all know कि Baraita are stout or shorted people, malnourished or malfunctioning organ like. So height and build is must. Posture, Baraita present with character stoop shoulder, like similar to sulfur. Means when the patient is come to a clinic, how to sit, how to look, how her hairstyle, how her fashion is also necessary things. Next is general constitution assessment. General constitution, like a speed, quick to response, slow to response, speech, actions, like a slow or speed. Fear. Next, activity levels. Like some people are restless, some people are like lethargy, dull. Some people are balanced activity. So, activity. We all should observe in genetic understanding of human being to find similarium. Side affections, like left-sided or right-sided, means if brain is left-sided working, then all complaints should do act on right-sided body. If brain is left-sided, sorry, right-sided, then all complaints should be mostly right-sided. In generally, left-sided people are like a left-sided affinity. मीन्स किसी को लाइक पेन हो रहा है, जॉइंट पेन हो रहा है, देन वो जॉइंट पेन हो रहा है, वो लेफ्ट साइडेड है, तो मे बी ही और शी वाज इमोशनली सॉरी इमोशनल, और अगर इफ complaint is right sided like a right joint pain or right something etc anything else, right affinity, then he or she should be logical or intellectual. Appetite also, in general makeup we considered, uh, even like hunger aggravation or can't bear hunger, or they suggest like a financial crisis in childhood. अगर किसी पर्सन को या पेशेंट को कुछ ऐसा होता है कि भाई इफ दे हैव अ प्रॉब्लम इश्यू अबाउट एपेटाइट, मैं भूखा नहीं रह सकता कि एक्स वाई जेड एक्सेट्रा, then there is a something financial crisis or financial face he or she face in childhood also, like a parents struggling about their basic need. Likewise, in appetite also there is a aversion, desire. Even desire also pursue or shoot like some business tycoon या businessman wants spices, मीन्स के वो डिजायर भी स्पाइसेस वाली होगी, और लाइक some persons have craving for sweets because of he wants or he or she wants love, so he have a craving of sweets or chocolates etc. Sleep patterns must, like a carcinosin, wow, sorry, arms and sorry, elbow and arms and legs are like close to each other positions. In Gujarati we say tutti વાળીને સુવે. So sleep patterns, positions, dreams. In dreams also we have considered discharges, like physical excretions, likewise urine, perspiration, odor in biological cycles also. So we all considering genetic understanding of human being. So three pillars our SORA, psychosis and syphilis. ये सब हो गया genetic understanding which fundamental difference में. So in every also in every medicines our remedy materia medica and our remedy has also there is a three phase of personality, like a soric, like a psychosis, like a syphilis. In syphilis sulfur has cleanliness. In Sora, we have a dirty, filthy look, but in sulfur, in syphilis stage, there is a cleanliness mania also. In cleanliness mania also, sulfur have three marked already. So it's syphilis. So we have to consider our disease pattern, our defense mechanism. Means when patient comes to for treatment, then we should consider the disease pattern, key of defense, which type of defense, like a SORA, like a psychosis, like a syphilis. And then we also consider this remedy, like a close remedy are similum, we conclude the similum. Then also select like a वो part syphilis cover कर रही है कि नहीं. We have a study about Baraita groups. In Baraita groups, there is a Baraita carb, Baraita phos, Baraita mule, Baraita sulf, and Baraita iod. Baraita carb of barium, foundational element. Baraita phos में phosphorus, Baraita mule में chloride of barium, Baraita sulf में sulfate, like a deeply skin remedy mostly. And Baraita iodine. In Baraita carb, in Baraita, classic materia medica paints a rigid picture, profound timidity, bashfulness, delays, physical milestones, poor memories. We consider the Baraita like this, like a bashful, like timid, like a dependent, like a low memory, low intelligence. But should we wait for delayed milestone to prescribe it? No. We must learn to detect the core Baraita element, even inside normally intelligent individuals. Like intelligent individuals also profound Baraita. Like IPS officer also have Baraita, personality, Baraita personality. Because Baraita Baraita is not multitasking, but Baraita is focused person. Like intellectually वो one work वो एक काम ऐसा करेगा कि करता ही जाएगा लाइक रूटीनिस्ट रूटीनिस्ट ही ऐसा ही करेगा कि करता ही जाएगा तो क्लिनिकल आइडेंटिफिकेशन व्हाट डज बराइटा sacrifice the defining exist of baraita patient is sacrifice of growth we as a homeopath consider what should here sacrifice every remedy uh, something and something कुछ ना कुछ तो वो sacrifice करती ही है so here baraita is sacrifices the growth the mental growth or both physical or mental both so let us see the baraita growth we need to know what is the thing that baraita sacrifice how it express and how it reacts to the deficiencies baraita how to react deficiencies strictly level the physical level or deeply impact so physical sign of baraita means physical points may suggest baraita first of all short stature we can think baraita if a man or woman is short in stature or how has not grown or his or her normal height. In his context, one needs to take into consideration the genetic inheritance too. If either parents or the whole family is short stature, then his shortness is not important, but should not lead one to inner in fact that the whole family is baraita. हाँ, वो consider नहीं कर सकते हम. Of course, if the intellect and the generals match that baraita, the baraita can be ruled out. Understand, underage people can also be short, thin, and emaciated constitution. But हम सिर्फ हम सिर्फ only one physical पे नहीं जा सकते. Short in stature, but in short in stature also there is a marked features considered. Then we think of baraita. They do not necessarily fall into the category of baraita as there is reason for the same, and that is lack of nutrition also. But in overgrown, disproportionate individuals can also be baraita carb, like a psychosis excessive. Baraita mur is often thin with thinner neck and sharper features. The nose baraita mur is thin and sharper. But baraita carb is like a lazy, rounded, broad-based nose, like a chubby type. Second is early alopecia, like a baldness early. Premature balding, particularly in uncharacteristic young age, like 25 to 30 years age. Baraita has old age also, looking old age, and also there is a baldness early. In Baraita carb, Baraita mur, especially Baraita mur, show broad forehead, hair affection often in general baldness, young people. There is a cover Baraita mur and Baraita carb also. Next, facial structure, like a prominent bony structure of jaw and rounded face. The face of Baraita has very prominent bone of jaw, which gives it a squarish look, a squarish type look, and fat on the cheeks that gives roundish look. Generally, according to the science of physiognomy, squarish of the bony prominence on the face indicate a strong character, like a positive, courageous achievers. And also Baraita is achievers. IPS officer also Baraita personality has. Baraita personality also. But here the character is completely misplaced. We consider the one thing misplaced. Next we consider and study about detailing misplaced. Next then a mental behavioral observation that may suggest Baraita, like a mental makeup of Baraita. Mental makeup of Baraita in consider we will. People who look down, bashfully or timid. Mental makeup of first of all like a physical makeup. Next we should show mental makeup. Will means people who look down whenever the patient is coming, like Baraita patient is coming. He can't even eye contact with the doctor or even can't even eye contact with the other strangers also. And if Baraita child is come, then he hide her face like a finger from like or hide behind the mother or hide behind the closed one. So if you like timid plus like a timid in high level. Timidity is so much exaggerated in Baraita, they do not want to show their face. He look down or away, इधर उधर देखेगा. Gracefully like a small girl. A child may have a habit of hiding his face with both his hands or as if he's ashamed. Graceful or timid. People who have no confidence in themselves, low self-confidence. We consider Baraita. A grown-up adult when he always prefers to be accompanied by his mother or father. Even adult age, Baraita like कोई किसी के बिना जाएगा ही नहीं, अपने क्लोज वन के बिना जाएगा ही नहीं. These are childish. The patient has no confidence or expressing himself to the doctor and would like someone else explain. बड़ा पेशेंट आएगा, बड़ा होगा तो भी 20+ होगा तो भी एडल्ट होगा तो भी, और फिर वो कंप्लेन वो खुद से नहीं बताएगा, उसके साथ कोई ना कोई आएगा ही आएगा, और वो लाइक मदर है या फादर है, और वो कंप्लेन एक्सप्लेन करेंगे, बराइटा कुछ नहीं बोलेगा. He is as if not grown to be independent. The accompanying person could be mother, father, friend, spouse. Very often we find that a couple comes to us treatment, but the husband keeps quiet and the wife does all the talking. All your queries are answered by her while the patient himself just smile and nods. ना में हाँ में वो अपना सिर हिलाता रहेगा. This gentleman does not look idiotic or foolish and could be an officer at some high post in firm or even a business, but does not have the ability to communicate. A high post or a tall academic degree does not rule out the Baraita element marked. Baraita element को rule out नहीं कर रहा है. On the contrary, behavior that does not befit a high post or a high academic degree is all the more an indication towards the Baraita element. Bashful है, timid है, bashful or timid, low self-confidence. Everything is in we consider. So then the high post or high businessman like we should not rule out the Baraita. वो हो सकता है Baraita. People who have too much confidence in themselves, accounting. Foolish behavior, defiant like, heedless, careless. Many rubrics cover the Baraita. In 3 rubrics, foolish behavior, defiant, heedless, careless, 3 mark Baraita ka. Obstinate. People who are unreasonably obstinate. We can't argue with them. उनके पास तो इंटेलिजेंस ही नहीं है, क्या ही आर्ग्यू करेंगे कर लेंगे हम. Arguably or indisably stubborn, they cling to views to protect themselves from exposure. वो अपनी बात पे चिपक ही रहेगा, वो कुछ like a glue type. One of the most difficult things is to convince the Baraita. Once an idea gets embraced in their mind, nothing can shake it. This is what we generally mention as fixed idea. There is no scope for reasoning in a Baraita because whatever he has in the head is final. Final is final. No one can change her thoughts, her mind makeup जो भी उसने मन बना लिया वो होगा. The most difficult thing is to make them follow the do's and don'ts of homeopathy. They will invariably apply to ointment on the rest. वो कभी इंस्ट्रक्शन फॉलो ही नहीं करेगा, उसको जो मन में आएगा वही करेगा. He has been explained to them or exteriorism. They can happen more than once despite prior warnings. They may argue, how can an external disease disappear with an internal medications? वो आर्ग्यू करेगा, वो अनरीजनेबली कोई भी रीजन देगा हमें, लेकिन वो अपनी बात नहीं छोड़ेगा. But there is also intellectual. There is a intellect Baraita. The intellect of Baraita that is sacrificed for survival. It is a defective intellect that throws a shadow over the will. There is a no good and bad in our mathematics. There is a exact point. जो नीड है वही होगा. लाइक बराइटा को नीड है, उसको सेक्रीफाइस करना है सर्वाइवल का, तभी वो सर्वाइव हो पाएगा. इसीलिए उसकी इंटेलेक्चुअल लेवल भी वो सेक्रीफाइस में जाती है. Is a defective intellect that throws a shadow over the will, intelligence, morals, attitude, reaction, sensitivity, etc. Thus, all the elements of mind show the wholesome effect of faulty intellect. Like without this type intellect is not a right to prescribe any Baraita soul. The intellect में बात करें in sense of intellect, there is a people who smile a lot, smiling, laughing causeless, laughing excessively, immoderately. कारण कुछ भी ना हो, बस हंसता ही रहता है. Smiling alone also when laughing serious matters over. There is a things of we think of Baraita. Many a times unnecessary during the interviews. They smile and laugh occasionally for petty things like there are ladies who every now and often hide their face in their hands or look away smilingly and bashfully to show embarrassment. वो हंसेगी भी और मुंह भी छुपाएगी. Like छोटा बच्चा होता है वो हंसता है और फिर मुंह छुपा लेता है ऐसे. Bashful smile. People who answers wrongly. Also we think of Baraita. तो पूछेंगे क्या वो जवाब भी क्या देगा. Start thinking of Baraita when you feel that. हाँ.
Madam, please talk in English because people from the other part of
Okay.
the world cannot understand.
Okay. Okay, sir. हाँ. Start thinking of Baraita when you feel that the move that once the patient is answering wrongly. The phone number, the address, the patient, the age even also. Patient is something everyone, especially a grown up, is confidently sure of. But many a time patient gets confused, even given a wrong address, like a mobile number given a wrong, especially in mathematical terms. Baraita is always fail in maths. Or like then after say, sorry, I made a mistake. Mistakes are allowed, but not in something which defines you, yourself and your whereabouts. People who are confused while answering. Varita is also confused to response, appearing dazed and highly muddled while answering. Like a patient comes to you with a backache that started years back. The patient tell you, this back is I remember started when I had been for mountaineering. I slept there many and my wife held me in at a time and I was saved. We ask him the next question, what was the age at that time? And the patient asked you back, whose age, mine or my wife's? Like confusion. Confused to response, confused to even react. Patient ask you back, whose age, mine or mine wife's? Well, obviously, he's confused. He's not in tune with the whole things that you are asking his history. Uh, we can say Baraita never tell proper history about her suffering or health, even her routine. When you meet and to change your questions 2 or 3 times to make a patient understand and respond correctly, you may be dealing with a Baraita. We often and often should questioning a different type. One question can't even solved by Baraita also. So, refarming questions 2 to 3 times even to gain comprehension. Then people mismatch priorities, like people who don't understand importance of important things to have a wrong priorities about health. As a person grows up, they learned many things and becomes wise. As a rule, he learns the comparative importance of things. This is more important than that. But in especially Baraita Cup, the learning process is the hampered and the importance attached to various things is improper. Just like a child cannot go where giving exam is more important or playing games. Confused state, like playing games or study, which are important. So many a times we see patients coming with serious ailments, it stressing and asking for her help for minor ailments. Example one patient gradually emaciating and withering due to cancer of liver insisted he treated first of his osteoarthritic pain in the knees and get relief so that he can be easily mobile. So there is a no even miss even he can't understand the variety importance of the important thing. First of all, we need to treat cancer, not an osteoarthritic pain, but the variety is a pain. Variety is a pain. So he want to mobile, he want to free from pain. He can't even taking a cancer as a serious. So there is a misplacement also. Wrong priorities even at work or home or hallmark of Baraita. Like a rigid routine, deeply fixed routine, severe discomfort in normal structure shift. For example, a housemaid who is a Baraita while working in the kitchen will not bother about the running tap water. That is going down the drain as the dutifully tries to put the utensil and plates in plates. Nor Is she bothered about his gas stove, which is burning without a utensil? As she is sweeping or whipping the floor. So there is a no proper prioritize the work. There is no proper even in work pattern also. There is also confusion. There is also a misplacement. There is also a restlessness also. Let's just say like um, where utensils are down from her hand. Gas stove is burn ho raha hai, gas stove is burning, but there is a they have something other work like sweeping or wiping the floor. Her priorities are completing the routine housework in the bargain to hell with the wastage. So there is also a misplacement, prioritize. People who are fixed in their routines, rigid routines, like a lack of proper coordination between the left or the right brain makes a bright are not adaptable. Judgments are totally lacking to change a reaction to different or changing situation. It's totally different from them. So they stick to their routines. There is they can't accept even anything new routine. Work desire for mental routinizing. Can't even minor changes even can't bear, Baraita. Like phosphorus can't bear the routine. Some other remedies also can't bear routine to bear phosphorus. Like they can't even वो कभी routine is हो ही नहीं सकता. लेकिन but Baraita there is a stick to routine her because of there is a lack of mental state. It is not right to say that they can never accomplish a job once they learn to do a job easy or difficult, and once the process is embedded in their heads, they can do things accordingly to it or for years without even any change. Even many years, they stick to her job or work or etc. But continuous. No only do the Bharatias not change their routine, but also they cannot accept anything new in suddenly. Sudden change they can't accept. They cannot change, nor can they accept change in the circumstances even. It's already mentioned they have efforts to change the progress also. Progress means change. If one cannot improve upon oneself, one cannot progress. The mind has to be open to experimentation, innovation to foresee the result. The foresee one needs to an analytical mind, but they can deduce things and come to right conclusion. All this is absent in Baraita. They can't even uh, uh, they can't accept the promotion also because promotion means responsibility, more and more responsibility. But they can't even accept the promotion because वो can't take an responsibility on her or on them. Even some surgeons are very much routinist. They just cut the extirpate tumors or tissues according to the what techniques are mentioned in the books. So a surgeon, or like a surgeon also, Baraita, they cannot innovate any new surgery and techniques. They cannot change with the changing times. Homeopaths too, who go for with her routines, way of prescribing and are not open to any suggestion, would fall in the this category also. Well, then next variety is orthodox, old orthodox thinking, who do not want to change with changing time also, can also the variety. This obstinacy, despite not getting good result with their old technique, like prevents them from shifting from their fixed routines. However, the scientific could their arguments be they may refuse the change for a professional. The question that should be asked is whether they stick to a routine prescribed by the seniors or do they tend to innovate by adding something good by their own. If not, one can start thinking if he is brighter. Then there is orthodox time thinking or older, more refuse the new modern changes, or even they can't use new gadgets, modern machines or equipments. Even they can't accept the technology also, cannot utilize, can't. Baraita, despite being taught again and again, will filter at even operating an ordinary washing machine or a disc player. They do not even learn simple things and are taught to them, but next time they fail to remember, and leading to the frustration. And the final conclusion, I can't operate it all. I can't even manage it. I shall never be able to do this or that because it's not my cup of tea. This is brighter thinking. So also in driving a car, a brighter man or lady is convinced that he or she will not be able to drive and control such a complicated thing. A pilot of a plane is supposed to be an expert in maneuvering such a complicated thing like a plane. But a patient who was distinctly a Barita told me that he could fly a plane, but he did not have a license to drive a car because he felt it was the most difficult thing to do and he cannot be learned driving through he tried to. When asked why, he said that there are more than one thing to concentrate on and he found multitasking difficult. So there is a can't people, Paraita, who can't do multitasking. People who are incapable or wrongly convinced that they are incapable could be belonging to the Paraita group. So we come to the point, no multitasking. Multitasking means struggle. Baraita can't struggle. Baraita always think at time at work, at a time at a work. Even if focus 100% in one thing also, only on one thing. In this fast moving world, everybody seems to be always short of time. We also rushing about to complete his or her work, then to with his deadline. That requires multitasking, which means trying to accomplish many things simultaneously. This requires multiple concentration or focus. A working lady who has a complete her daily course and then attend her office generally tries to do many things at a time. She keeps the milk on the stove, boil it at a time, boil, keep something in the oven, and when both these things are getting ready, we'll set the washing machine to wash her clothes. Which means multitasking. At a time, wow, many works are doing. But in Baraita, there is a just only at a time one work. If they go for multitasking, then there is a mashup. There is a वो सब mashup ही हो जाएगा. वो can't able to work in a rhythmic. Then after people who do not change their jobs for years, inflexibility. Sorry, professional stagnation. Means के वो stuck हो जाएगा. Like they do not have the capability to take responsibility. They refuse promotions for fear of responsibility. So they stick their job for many years, even without promotions. In our in manpower there is a variety is a beneficiary because there is a in less payment they work hard because वो routinist है. Oh, sorry, because they are routinist, so they stick to their work. वो work अच्छा करेंगे लेकिन एक ही काम करेंगे. People who cannot change their plans at the last moment. Inflexibility. Like we have also even our friend group make a plan, then at last moment there is always a change in the plan always. But in Baraita, if a group in Baraita there is no change in plan. If Baraita was planning, then there is a stick to plan. People who plan things in advance can belong to many constitutions. There can be so many reasons for people to plan their work, like arsenic planning plan to their work, and according to their planning, if he should or they should work as well. Even phosphorus, they plan, but their plan is always ruined. There can be so many reasons for people to plan their work well in advance. The most important reason is cautiousness. People who do not like to make mistakes due to their perfectionist nature, like arsenic, would like to plan. People who are anxious about things in advance and have a tremendous anticipatory anxiety and will plan in advance. So many we have many anxious remedy like argentum nitricum, like a lycopodium. So they plan early and follow them also very carefully and cautiously. People who do not want to fail at the last moment, so lest they must be laughed at. People who are concerned about their image will plan out so that they always perform the best. who can planning early, then people who know that they cannot adapt to any new development at the last moment will be cautious and plan will be in advance too. But there is a category belong to Baraita. They have their plans well in advance. Even they cannot imagine a making trip out to a hill station all of sudden. Like a plan, or they make a plan for beach, but at last moment they can't even change the plan to beach to convert to into hill station. They cannot take any decision at the spur of the moment. They can't. People who cannot observe properly, their also should be a baraita. Deficient observation. There are some people who this sharp, keen observation, like a Ophidia group, like a phosphorus, like a quick remedies, all quick remedy have sharp observation. But observation also requires intelligence. Or Baraita have no intelligence. What to observe and what not to observe is also governed by your intellect. As Andaman said, eyes do not see what the mind does not perceive. So, if Baraita have no observation skill, then gullibility means that people who can be cheated again and again. Baraita person, Baraita patient, more and more, often cheated again and again. Even he has a time doing mistake. Like if you fool me once, same on you. If you fool me twice, same on me. Baraita. Proverb to adapt to Baraita. If we find a businessman who have been cheated again and again, even as if why mistakes, why cheating, sir? Cheated losses, then we should be think of Baraita. No adaptive learning, like people who do not learn from their mistakes, even when corrected. Mistakes, it is said, are the best teacher. This is a corollary to the saying, like experience is the best teacher, mistakes is our best teacher. Mistakes से सीखेंगे. But in Baraita, learning the same things over and over again, but in remain untrained. This is not always true. The Baraita is the big of to differ. Experiences comes and experiences go, but Baraitas never change and never bow. Then next to lack of leadership. People who have never changed or to try to change their jobs, even also people who can never be leaders. Baraita never be leaders. So leaders say if they are leaders, then they are not Baraita. Baraita constitution can never lead. It always a follower. Instruction follow ही करेगा. It find itself leader's position. It will go on a beaten track, but it also follow either a book or an advisor. But also there is appear in rubric of egotism, Baraita. It is seen apparently to have one. It is a foolish misplaced ego. Then we come to next positive axis of Baraita. Positive side of Baraita, intellect. Like Baraita has an excellent ability to a fixed job. Once they are used to a particular job, no one can beat them. Because so there is an IAS, IPS officer also a Baraita personality. However, the complicated the job once they had routinely mastered it. When then can go doing it for years without mistakes. Such variety may excellent clerk, accountant, worker, even doctor, teacher, etc. They can fix the idea and routine rule them. There is no rule out. There is rule them. They never break rules, not only because they have no ability to circumvent the laid down rules, but also from fear that they might not be able to tackle the after effects. Adverse effect can't tackle them, even can't even think of them. A patient father's bed described his daughter. Her brain works like a computer. Whatever is been fed will come out as it was fed without any mistakes. There is not even 1% of a chance to mistake. But if you change the trait or ask her something that has not been taught to her, she gets puzzled. Her brain will go even not given any answer. Then we should think also Baraita. Baraita is intelligent, but in only on one focused way. There is no other way. There is no other second option also. So, one word identifies variety is also misplaced. Misplaced is marked. Misplaced means inappropriate or wrong. In misplaced, there is a everything inside the Bharata constitution essential is misplaced. The core, there is a misplaced place. Misplaced in many terms, like misplaced prioritize about God and religions. There is a fixed idea about certain things make a Bharata, not understanding the relative importance of various aspects of life. Their whole world will revolve around it. A certain things that is fixed in Bharata's mind, and there is a follow them, like a religious affections. Uh, uh, Superstitious also comes to them. Misplaced courage. There is a audacity. Courage is boldness. It is the ability to face danger. The ability to face danger situations stem out the various factors. Experience in a certain field and knowledge of a field or situation gives one confidence and hence the courage to tackle such a situation. There is a purely stoic courage in Baraita. The technique of tackle grave situation is also known and hence the pros and cons of the situation also understood by a person who gives rise to the ability or hence the courage. The firemen, the soldiers in the army are example of it. Like a misplaced courage, but there is a Baraita. Them there is a courage which is blind courage, motivated by the desires to achieve. The goal is important for an individual. It should be achieved at any cost, even if many sacrificing one's life. This courage is syphilitic courage. Here, the person is aware of the consequences that may be destructive either ways, except it for the sake of achievement of his goal. So, Baraita is the best achiever in goal. The religious fanatics, the terrorist organizers, and those who have do or die attitude exhibit a syphilitic courage. There is also psychosyphilitic courage, like a foolishness, reflect as a courage, but actually is foolishness. Audacity, we terms as a audacity, audacious. Stuntman, audacious. Foolish behavior. Courage, there is a courage, but there is a foolishness courage, audacious. Then we come to misplaced or disproportionate anxiety, fears, or apprehension. Like anxiety refers about fear happen something will cautious anxious. Cautious anxious means there is no intellectual. There is no intelligence involved in anxiety. Such anxious thought, there is no tail and no head, like that. Then misplaced love, attachment, and affections, like attachment. Baraita can show undue love and affections to animals. They appear to be animal lovers. So far, so good. Baraita should be animal lovers. There is nothing wrong about loving animals. Even carcinosin, chocolate remedy, netramure also have animals, love animals. Exhibit by looking after them and feed them. Here, the Baraita goes overboard doing things for an animal or insect. Example, 40 years old man was being treated by chronic liver problem with recurrent attack of appendicitis. He was a medium built with a fast receding hairline. He happened to be working for a brokering company. This chilly, obstinate, angry person and working with finance failed to respond favorably to many constitutional drugs. He was very intelligent in the finance field, but he has advised many on how to become a millionaire, but he himself was barely having any sound investment. Barely. On a retake history, his wife and his sister elaborate that his love for small living things on his earth, except for people, at home or any relative. This is a peculiar behavior, like his drew attention. People, especially distant relatives from his native place, come down for treatment for cancer to Mumbai, and he was forced to help them. He always complained about their nuisance is against this when he would go out and park for morning walks. He would be on constant lookout for small caterpillars, small insects, and leaf and put it away where no man would trample over it before putting. it away. Would feed it with a piece of biscuit. This is not an isolated case of or sympathy. The wife fretted and fumed. His wife mentioned about another incident. On one instance, a pigeon laid an egg in a small plant pot that was on window sill of our kitchen. He was so excited and anxious that he raised a hue and cry in the house to warn all the members of family not to water the plants as the egg would get soaked in water and the embryo within would die. Life is very important even when it's not born. He insisted. When his wife drew his attention that this would kill her little plant, he came up with a brilliant idea. He put a straw in the pot so that the water could be supplied to the roots only without affecting the egg. Now he said both the eggs and the plant also will survive. So there is a animal lover, plant lover, like a nature lover. There is also a Baraita. Clinging love. Baraita has a clinging love. Oh, because Baraita is dependent in every situation, in everything, in every person, close one. So there is a clinging love also. A misplaced response answering. Answering issues completely out of context. Sorry. Misplaced response. Answering we questions something XYZ or Baraita answered ABC like that. Even a response also misplaced. Even in his serious things he laughed. He laughed in loudly. So there is a misplaced response. Misplaced even understanding. Misplaced understanding. A lady came with carcinoma lungs. This lady was very good in studies. As a child, she would stay in a joint family in the constituted almost 20 people is a common in Indian society. So over a surprise, she said that she did not know who her father and mother will till the day she got married. She considered her grandfather and her grandmother as her parents, and in her mind, her mother was her sister-in-law. So there is a misplaced understanding. We can imagine that how this situation is uh, comes misplaced understanding. Then our misplaced behavior. In misplaced behavior which does not relate to age, like speaking like a child, behaving like a child, childish behavior. In old people also, talking like a childish, uh, vivaciousness. Even misplaced in the confidence or misplaced assessment of own abilities, like foolish behavior, irresolution, indecision, physical misplacement. But it is in pet attribute to finding trouble because of foolish courage and confidence. There is a borrowed troubles in Baraitas. Even misplaced priorities, importance, and seriousness. Misplaced actions, indiscretion. There is a marked indiscretion rubric. There is also an indiscretion rubric. There is a marked Baraita. They can never even can't even take any decision. Never. Misplaced opinions. There is also a Baraita. Even there is a physical pattern, physical sphere. Everything is misplaced of age. In 20 to 25 years age, there is a looking young age, but the Baraita patients looking old, especially Baraita Kab, start looking like 40 years old in 20s. Or a fast receding hairline cause franks, glaring frontal baldness in Baraita Kab and Baraita Muro also. Old looking infants also. There is in children a wrinkled face, like a children who look thin, scrawny type, older than their age. Misplaced build or physics, dwarfishness. There is a dwarfishness, misplaced build, growth affected disorder, like a development arrested. CP child, we can consider also there is a Paraita in some cases. Even overgrow or less grow. In both cases, there is a Baraita. A malfunctioning of organ. There is a dwarfishness, development arrested, Baraita. We should consider Baraita. But there is a last at revision point. There is a some entry point of Baraita. we can entry from these points. Like a Barata is thirsty, chilly, right-sided, then timid, bashful. Bashful also there is a Barata. In children we can sharply show bashfulness. Grows up and who with grows up like an adult to patient, but comes with a parent or spouse or close one, and explained by them, not by Barata. Complaint explained by them. Even so overconfidence, but sound foolish. Too much. Some Baraitas also too much talk or to show overconfidence, but they are sound too foolish. We also even observe our clinic dull or foolish patient. Yeah, Baraita have repeat same mistake again and again. Entry point. Baraita understand importance thing. Baraita can't importance. Sorry, important things. Importance to your important things को importance नहीं दे पाता. Weak memory. Baraita. Fixed job for years. Baraita. Fixed routine and can't adapt to new change. Even can't even minor change. Except Baraita. Can't use modern gadgets. Even can't even new technology, new era, can't accept. Even there is no confidence about them to how to use, how to work. Even in routine life also there is no any change to apply new things. No creativity, Brighta. Mark point. No creativity. Creative है ही नहीं उसमें कुछ. Marked point misplaced. Misplaced in behavior, misplaced in obstinacy, misplaced in even response, answers, slowness in everything. Slow development, slow retarded growth, dwarfish, slow in understanding and reaction also slow. We questions. Then after 1 to 2 minutes, they think, and then after 1 to 2 minutes, or total 4 to 5 minutes after, then answer. Think of Baraita. Slow progress of disease, like a slow indolent, non-healing ulcers have Baraita. No, even any Baraita have a healing process also slow. We also consider the personality, like a quick remedy has a quick recovery. Slow remedy has a slow recovery. Simillimum है. Well, there is a simillimum, but there is a quick response, quick remedy. Slow response, slow remedy. Chilly, thirsty, slow, misplaced, right-sided, all think of we should brighten. And then last in facial structure, there is a rounded features, knobby nose, knobby. Occasionally a mixture rounded and squarish face. We think of also Baraita. And old age, baldness, and early looking old age in adult, like a 20 to 25 years old age person, but there is a looking 35 to 40 years. We think of Baraita. So there is a entry point for Baraita. So thank you all.
Very thank you, ma'am, for the informative presentation. If you have any case regarding Brata, you can share.
Sorry, ma'am, I can't
If you have any
understand.
case, you can regarding Bratas, you can share, na?
Yes, doctor, but the time is only just 4 minutes, and no case can be presented during the time because we need time for presentation of a case. Simply come and but
Acha.
anyway, congratulations, Dr. Ashmita, for coming over here and delivering such a beautiful presentation on Beretta group medicines and particularly Beretta carb. As you pointed out, the thing is that most people believe that Beretta is good for nothing, but it is. It is.
Is,
It is not
hmm,
like that. You can. They have their own
Baraita is a good achiever.
Yes, you can achieve everything through Beretta if you the right you apply the Beretta card as
hmm,
per the time, and if you are not able to give it in time, and so not only in even in Beretta mode, everybody know that it is a very good medicine for hypertension also. So,
hmm,
so how it works? That's a problem. It's not all varieties are bad, but varieties can do wonders if you
hmm,
give them as they are sluggish in nature and they are slow in nature. Their activities are dull, and so the intensity of the medicine shall be is low, and you need to give a good impact on that, and you will have to repeat the medicine frequently. Otherwise, you may not be able to get the exact result you are expecting from a patient of that variety. What's your opinion on that?
Sorry.
Uh, how will you rate varieties in that respect? Because the potency selection is a very important factor. For example, in belladonna you can give 1/10 potency,
One name.
but in variety you can give
In Baraita, we think of about like a low potency. We start about to low potency.
6 or 30 at the potency. But
We can't think of a higher potency
and,
because
and
uh,
that also you need frequent repetition.
uh, because
Okay.
remedy is slow here. Remedy can't even respond. Even remedy, sorry, personality response slow. Baraita is also slow. So there is
And
a remedy response is also slow.
I'm inviting Dr. Manoj to say a few words.
Well, the couple of things are very important. The remedy, the medicine, the dose, potency, and the attenuation. These are the four important things. So depending upon the constitution or the personality or the disease condition, the pace of the medicine can be changed. So while giving some opinions on these things, we must be always quoting our organ of medicine or obey our organ of medicine. That's the
Uh,
important thing. Thank you.
Yes,
yeah,
sir.
sir.
Yes, over to Dr. Ramprasad sir to say photo thanks to the session.
Thank you, Dr. Dhanesh ji and everyone. Namaskar. Congratulations, Dr. Asmita Rathod. Very nice. Excellent session. Describe the Brata. Brata
Thank you, sir.
remedy is a very important in homeopathy materia medica. Brata main Brata role of Brata delayed physical and mental development. There are role of miasmatic, psoric and syphilitic and some psychotic. So very, very nice, excellent session. Behalf of IFPH, very, very thanks. Again, presentation. Thank you, Asmita. Thank you.
Thank you, sir.
Thank you, Dr. Ramprasad sir, Dr. Manoj, those who attend the in English session, and special thanks and congratulations to Dr. Ashmita and the principal of your college, Dr. Harshad Mehta. Harshad Mehta sir, for giving such wonderful person to this platform. Congratulations. Thank you all. And tomorrow we will have a session from another professor from Rajkot Homeopathic Medical College, that is Dr. Amar Thakkar, HOD and Professor, Department of Pathology, and so we'll be talking about changing role of homeopathy physician in the age of artificial intelligence and rapid technological advancement. With that, we come to the end of the day. It's program. Thank you all. Good night. Over to Dr. Mariama John to moderate the Malayalam session.